Hello, and welcome back to Senior Care Savvy. Today, we'll be discussing common health issues that older adults may experience during hot weather and providing tips for prevention. Firstly, let's talk about dehydration. As we age, our bodies become less efficient at regulating temperature and retaining water, which makes us more susceptible to dehydration. Dehydration can lead to a range of health problems, including dizziness, confusion, and even heat stroke. In older adults, dehydration can also exacerbate existing health conditions such as kidney disease, urinary tract infections, and constipation. To prevent dehydration, it's important to drink plenty of fluids throughout the day, especially water. Avoid caffeinated or alcoholic drinks as they can increase dehydration. You can also eat foods with high water content, such as fruits and vegetables, to help stay hydrated. If you have trouble drinking enough water, try setting reminders to drink or using a water bottle with markings to track your intake. Secondly, heat exhaustion is another common health issue in older adults during hot weather. Heat exhaustion occurs when the body overheats and can't cool down properly, which can cause symptoms such as headache, nausea, and fatigue. In older adults, heat exhaustion can also lead to confusion and other cognitive impairments. To prevent heat exhaustion, it's important to stay cool and avoid being in direct sunlight during the hottest parts of the day. Wear lightweight, breathable clothing, and stay in air-conditioned spaces if possible. If you must be outside during hot weather, take frequent breaks in the shade or indoors, and use a spray bottle or wet towel to cool down. Avoid strenuous activities during the hottest parts of the day and listen to your body's signals to rest and hydrate when needed. Thirdly, sunburn is another risk in hot weather, and older adults are more susceptible due to thinner skin and less natural protection from UV radiation. Sunburn can cause pain, skin damage, and even skin cancer. To prevent sunburn, wear a hat and protective clothing when outside. Use a broad-spectrum sunscreen with an SPF of at least 30, and avoid being in direct sunlight during the hottest parts of the day. Reapply sunscreen every 2 hours or more frequently if sweating or swimming. If you do get sunburned, apply aloe vera or a cool compress to the affected area and drink plenty of fluids to help your body heal. Fourthly, respiratory issues such as asthma and chronic obstructive pulmonary disease, COPD, can also worsen during hot weather. High temperatures and humidity can make it harder to breathe and cause wheezing, coughing, and shortness of breath. To prevent respiratory issues during hot weather, it's important to stay in air-conditioned spaces if possible. Avoid outdoor activities during the hottest parts of the day, and keep your rescue inhaler or medication with you at all times. If you experience symptoms such as difficulty breathing or chest pain, seek medical attention immediately. Lastly, it's important to be aware of the signs of heat stroke, which is a serious medical emergency that can occur in extreme heat. Heat stroke occurs when the body's temperature regulation system fails and can cause symptoms such as high body temperature, confusion, and loss of consciousness. In older adults, heat stroke can also cause seizures, coma, and even death. If you or someone you know is experiencing these symptoms, seek medical attention immediately. In the meantime, move the affected person to a cool, shaded area and cool them down with water or wet towels. To summarize, older adults should take precautions to avoid common health issues during hot weather. Dehydration, heat exhaustion, sunburn, respiratory problems, and heat stroke are potential risks that older adults should be mindful of and take steps to prevent. It is essential to stay hydrated by drinking plenty of fluids, especially water, throughout the day, and consuming foods with high water content. To prevent heat exhaustion, older adults should wear lightweight clothing, stay cool, and take breaks in the shade or indoors. You can also prevent sunburn by wearing protective clothing and applying sunscreen, and manage respiratory issues by staying in air-conditioned spaces and keeping your rescue medication readily available. Recognizing the signs of heat stroke and seeking medical attention promptly is also critical. Moreover, older adults can take additional measures to stay healthy during hot weather. These include staying informed about weather conditions, avoiding outdoor activities during the hottest parts of the day, checking on neighbors who may be more vulnerable to the effects of hot weather, and dressing appropriately for the weather. Keeping the home cool with fans or air conditioning is also important. In conclusion, older adults can enjoy the summer months while staying healthy by taking preventive measures such as staying cool and hydrated, avoiding direct sunlight during the hottest parts of the day, and being aware of the signs of serious health issues. Remember that prevention is crucial for maintaining good health and enjoying life to the fullest. Thank you for watching Senior Care Savvy, and we look forward to seeing you again next time.